access to nursing practice level 4. So now, what we need to talk about today is evidence-based care. So now, how does this relate to you as band 3, band 4? That's what you need to be focused on. And at the same time, what is your role in clinical practice? Why is this important to you? So this can come up in your interview. So now, let's make it more practical in our thinking, because this is very important when it comes to evidence-based clinical practice, as I just said. So what is evidence-based care and how does it work? So now, evidence-based care is kind of an activity when it comes to reviewing, assessing, using the latest clinical research or clinical data that health professionals use in decision-making. So now, who are the health professionals? That include you. What are the data? How do they put it together in practice? Let's talk about clinical practice. So now, health provider, that's you, integrate this evidence with the clinical expert that consider patient preference. That means when you are putting this evidence base together, it includes patient preference, values, that is to ensure that you are providing quality care that promotes good outcome. This is done through MDT. So now, MDT means multidisciplinary team. Doctors, nurses, maybe family, carers, a patient themselves, depending on your patient mental capacity. So it's very important you understand when we talk about mental capacity. So let's break it down. What is your role and why is this important to you? If you look at the process we talk about, reviewing, assessing, using latest research in clinical data. So now you are responsible in all this area. It involves your documentation, your communication, your mandatory training, how evidence you are in terms of your decision-making in your education. What information do you have? So now, as a registered nurse, you might want to look at your professionalism and trust, prioritizing patient care. However, you studying access to nursing practice level 4, your level is based on level 3 and 4. So you are very important when it comes to this decision making. Yes, you support the nurse, you support the registered nurse, you support the doctor, you support the manager. That is your role. So why is this important to you? To come back again. So now we know the process of evidence-based now. So let's look at the activity. You know, in one of your unit, aseptic activity. Yeah, you remember your aseptic activity. So activity related to aseptic technique. Activity related to aseptic techniques. This involves, for those who involve in coronavirus, when we talk about COVID-19 and all that, look at all the activities that were going on. So now when we talk about aseptic technique, we're talking about hand hygiene, equipment that are sealed, sterile equipment use, and proper infection control. So now, when we're talking about proper infection control, we're talking about, say, maybe you're going to take your patient blood now, or you're going to perform injection or medication. The first thing you need to do is to wash your hand before you start. Right, wash your hand. And in every technique you are using, in every item you change, you need to also wash your hand. After finish dealing with the patient, you need to also wash your hand. Understand the importance of aseptic techniques when it comes to full apron, gloves, whatever is required. This is where you also need to focus on your policy, your company policy. What did they say about this job you are going to do? Even if it's personal care, what does the policy say about personal care? I understand there's patient-centered care or common sense. However, when it comes to evidence-based, there's nothing common sense in evidence-based. It is evidence based on how you are to provide care for this particular individual. So now what you provide evidence-based care for patient A is different from patient B, it's different from patient C. Yes. So your communication is what matters. Not only you are practically doing this, maybe moving and handling, for example. In some care home, nursing home, hospital, is very important that the hoist you use for patient A, you might not be able to use for patient B. Why? Because their weight might be different, their size might be different. So the wheelchair you use for patient A, you might not be able to use for patient B. Not only their size, weight, sometimes when we talk about infection control, depend on their diagnosis, their illness, or the ward you are bringing it from. You need to understand what ward are you bringing it from? What are the kind of infection control practice are they there? Do they have there now? Or what are the risks right now in the hospital where you are working? So the other thing you need to put in mind when we talk about professionalism starts from you understanding time management, documentation. So when we talk about documentation, that's the power of your communication. Documentation is the power of your communication. So this induction you have today is for me to remind you of the importance of your role in providing evidence-based care. So it can be your interview. What makes you think you are the best person for this job? The best person for this job is someone who can provide evidence-based care. Evidence-based care is care that is centered to individual based on clinical practice. We're talking about care plan. We're talking about values. We're talking about compassionate care. We're talking about patient-centered approach and documentation. So now we step past aseptic techniques now. Let's go straight to when we talk about principle in providing evidence-based care. So the major principle is about information that doctor find out. Where is doctor going to find out this information? Or maybe you have 50 staff in a hospital. How would they find out how to do this job? Maybe you are the only one on shift now, and the other team are starting with you. How would they find out what you have done, the service you have provided for this individual, the test, the assessment you have done, the diagnosis the doctor gave you, the medication the doctor prescribed? How would they know you have given the patient medication today? It's through documentation. Documentation. So not only we provided this perfect evidence-based care as we are, when it comes to providing evidence-based care, another thing you need to understand is that how excellent are you in continued professional development? Your professional development. Yes, you need to be proud that I have up-to-date mandatory training. They are up to date. Don't let your manager question you on that. Another thing you need to find out when we talk about documentation is communication, verbal, physical, whatever approach you're going to use. Majority of people might not have access to that care plan computer. So you are the one giving handover. You need to know the priority, the information you need to give during the handover. If it's 5 minutes, make it sharp. You are giving information in handover, information that are important, relevant at that particular time. And make sure you refer them back to care plan. Your patient preference, those who are having a diagnosis or having side effect or having any allergy. Yes, patients who are having allergy is also very important. Among all this, You yourself need something when we talk about self-care. So self-care starts by you completing your mandatory training, booking your holiday, having time to sleep when you finish your work. Break time is not for TikToking. Your break time is for you to relax and compose yourself before you go back onto the world. Not only you have completed your mandatory training now, you know when is your holiday, that's perfect. Good pay, that's okay. At the same time, you need to join union. Yes, very important. You need to join a union. The importance of union is not for you to be talking or disengaging in activity that are happening on your work or overriding your staff or manager. No. The most important of union is for union to help you, remind you of your CPD, continued professional development. Also talk to you about regulations, things that have changed in your job. Is it pay rise? How can you put that information forth to your employer? So that is where you have your union to help you promote that evidence-based activity that are going on. So thank you very much. For those who didn't attend the class today, we have recorded this video so that you can have it to watch and understand when we talk about evidence-based. This is the last part of your clinical practice. So some of you are having practical section next week, and make sure you attend. It's very important, your practical section. I know some of you are not available. You want to do your practical section on Zoom or Teams. You must be ready to spend 8 hours, although there will be break in between, to do your practical section online. And your video must be clearly visible, that you are clearly visible to your educator. At the same time, if you turn off your camera or anything happen along the line when you are watching or when you are doing this practice, that is, you have lost the training. You now have to sign back on, but there is possibility you might have to pay another fee because this program is only 4 weeks program. Yes, it's only 4 weeks program. It's for you to build your evidence-based skills. For those who are registered nurses who are not very confident, because we were focusing on medication management, aseptic skills, injection, and all that. And those who wants to work as a phlebotomy as a full-time. So that is why these 4 weeks is very important. It's for you to have a package to be able to prove yourself that yes, you are band 4 and you can do this job. So thank you very much. My name remains Alex Oni Edigan. If you want more of this program or you want to join us, you can always visit our website, OFC Training College.co.uk.